my name is Whitney Hunt, and I will be talking about tuberculosis today. I chose the verse Colossians 1:16, which states, "For in whom all things were created, things in heaven and on earth, visible and invisible, whether thrones or powers or rulers or authorities, all things have been created through him and for him." I chose this because it's a good reminder that microbes and bacteria were created good, even though they cause disease and illness. And it's also a good reminder that there's good bacteria and bacteria that we need, microorganisms that we need in our body. So it's just a good reminder altogether that it was never created to hurt us, and God created it through him and for him. Okay, so first thing we're going to talk about is signs and symptoms. Some signs and symptoms of tuberculosis include unintentional weight loss, fatigue, night sweats, chills, fever, and loss of appetite. But once it gets into the pulmonary system, symptoms may include coughing, and the coughing normally lasts longer than 3 weeks. There's also hemoptysis, which is coughing up blood, and chest pain as well. Mycobacterium tuberculosis is what causes tuberculosis. It's the bacteria that is the causative agent of tuberculosis. So the physiology and structure of this causative agent is very important in understanding why it progresses so fast and why it's able to survive the conditions that it does. So Mycobacterium tuberculosis is a prototrophic, metabolically flexible bacterium that has achieved a spread in the human population that is unmatched by any other bacterial pathogen. This is because of its ability to adapt in different environments, or adapt in different environmental changes during infection, such as nutrient deprivation, hypoxia, various exogenous stress conditions, and the intraphagosomal environment in the case of pathogenic species. So just the idea that it's able to adapt to those different environmental changes is very important in understanding how the disease is spread so quickly. Okay. Next, we're going to be talking about the structure more so of the microbacteria. So microbacteria are gram-positive. They are acid-fast. They need oxygen to survive. They have an irregular rod shape, and they are very small in diameter. They have variable length though, so we don't really know the exact length. They contain mycolic acids in their cell walls, and they have a cell envelope, which is responsible for the low permeability of the cells. That is very important in the structure of the Mycobacterium tuberculosis. So it's also very important to understand the pathogenesis and how the bacteria is contracted, or the disease is contracted. So Mycobacteria tuberculosis is airborne, so they will enter the host by air. This makes it a very contagious disease because obviously everybody's breathing in air, and it is not taken in by contact of like objects, so it's only transmitted through the air. Depending on the different environments, it's possible for the bacteria to survive in air for multiple hours, so that's also very dangerous and another reason why it makes this disease very contagious. Typically, when the body notices a foreign substance or bacteria, macrophages will engulf it, but this species contains genes that allow for mycobacterial survival inside of the aggressive microenvironment of the host macrophages. So it will literally live inside of the macrophages. This bacteria can remain dormant, so that's also very bad because a lot of times people don't see symptoms, so they don't suspect anything, and it'll just become active out of nowhere. The transmission, like I said earlier, happens through the inhaling of a droplet of the Mycobacterium tuberculosis, and it can enter through the mouth or the nose. and it'll go into the upper respiratory tract. So the next thing we're going to be discussing is epidemiology, which is very important because understanding this aspect of Mycobacterium tuberculosis is crucial for the effective control of the disease. So it just helps us understand like what has been used in the past and what has worked in the past. So streptomycin was actually the first drug to be used on Mycobacterium tuberculosis, and it was used on drug-resistant tuberculosis. So it had good results, but then about 3 months after the treatment, the patients trying the treatment began to see a decline again. So in that, we see that there was in fact resistance to the drug, so it stopped working after a while. It developed the resistance to the drug because it was working for the first 3 months, and then the decline happened. So the resistance to the drugs led to the idea of chemotherapy to treat tuberculosis, which remains the most effective treatment today after what I have researched, which isn't what I would think of when I think of treatment for tuberculosis, but I found many sources on that. Further information on treatment, control, and prevention would include treatments such as 1 or 2 types of medication, so they would actually combine the medication. That's for latent tuberculosis. For active tuberculosis, there's going to be several medications given at a time. If it's a drug-resistant form of TB, like we discussed in the last slide, then further action will need to be taken, so maybe chemotherapy, depending on how the patient reacts. And prevention is a tough one, but basically in order to prevent tuberculosis, the only thing we can really do is treat it to stop it. And then control of tuberculosis, there's administrative controls, environmental controls, and use of respiratory protective equipment. So you basically just have to avoid it altogether if you want to try to control it, or just keep people indoors that have it. So yeah, it's a little bit difficult to control it, but treatment is the best option for that. So for how I can incorporate this in my worldview as a Christian, I kind of just related it back to the pandemic that we're going through right now. It comes with a lot of responsibility for healthcare workers. And as a Christian, I feel like it is my duty to help people that are affected by this in any way, which can be either just talking to them and reaching out to them and seeing how they're doing, or helping them physically. So currently right now I'm taking classes in order to get my CNA license, to go into the field and get into hospitals and help as much as I can and as early as I can, because it's needed right now. So I'm just trying to get that done and trying to get into the hospitals to help out as soon as possible. So whether it's an outbreak of tuberculosis or an outbreak of COVID-19, what we're experiencing right now, it's my job to help God's people. So I think I would react in the same way that I'm reacting now. But as of now, while I'm taking those classes and trying to get into the hospital and help as much as I can, I'm just doing my part in washing my hands and staying inside, as well as advising others to do the same. So yeah, just making sure that everybody's doing okay and doing my part in trying to control the outbreak as much as I can, and trusting in God in this whole situation is basically what I would do with tuberculosis too. So yeah, that is all for my presentation today. Thank you so much for listening.